Leprosy, a disease of the skin, will.
Causative agent. The causative agent of leprosy is a bacterium which is called Mycobacterium leprae. The characteristics of the bacterium are that it has rod-shaped single arrangement cells that have a waxy outer coating. This thick, waxy outer coating hinders the mycobacterium from taking in nutrients, which significantly slows its reproduction time to about 14 days. This coating of lipids also makes Mycobacterium leprae hydrophobic, which makes it hard to kill because polar molecules cannot reach through its cell walls. Mycobacterium leprae also is gram-positive.
Epidemiology. About 180,000 people today are currently afflicted by leprosy. According to the World Health Organization, most of these people are inhabitants of Africa and Asia. In the US, about 200 people are diagnosed every year. Most of them live in temperate, tropical, and subtropical climates, the South, California, Hawaii, and other US territories. Mycobacterium leprae is a very slow-growing bacterium. Its incubation period is about 5 years, and symptoms can take as long as 20 years to appear. Leprosy is not the immediate cause of death. The effects of leprosy generally are the main cause of death. The mortality rate of leprosy-infected people is 4 times higher than that of the general population. 1 to 2 million people are irreversibly disabled due to the effects of leprosy. The morbidity rate is lowered by early detection and early treatment to symptoms. Human beings are the only known reservoirs of leprosy. Children are more susceptible to infection than adults. Leprosy was once thought to be highly contagious, but in reality, it can only be transmitted through close and repeated contact with an afflicted person's nose and mouth droplets. Hence, with the advanced technology and antibiotics that are now available, leprosy can be detected early, making it not all that contagious. Pathology. Leprosy primarily affects the skin and the nerves outside the brain and the spinal cord, called the peripheral nerves. It can also strike the eyes and the thin tissue lining the inside of the nose. The main symptom of leprosy is disfiguring skin sores, lumps, or bumps that do not go away after several weeks or months. The skin sores appear to be pale-colored. Continued infection without treatment due to leprosy can cause a loss of limbs and appendages. The rate of new infections vary from 6.2% per 1,000 to 55.8% per 1,000 in areas where the disease is more common, like Southeast Asia. It usually takes 3 to 5 years for symptoms to actually start to appear. Some major signs and symptoms include skin lesions and pain, growths on the skin, numbness on affected areas of the skin, muscle weakness or paralysis, especially in the hands and feet, blurred vision, stuffy nose, and bloody nose. When a loss of sensation occurs, injuries can go unnoticed. If this happens, one should try to avoid such injuries if possible, since you cannot feel pain that can warn you of harm to your body.
Go.
Responses and treatment. The degree of natural immunity to leprosy is already high, so there is not necessarily a need for a preventive medicine. A number of different antibiotics, including dapsone, rifampin, clofazimine, fluoroquinolones, macrolides, and minocycline, are used to kill the bacteria that cause leprosy. More than one antibiotic is often given together. Aspirin, prednisone, or thalidomide is used to control inflammation. These treatments affect the progression of the disease, but it all naturally depends on the person and their immune response to it. Prophylactic measures that can be taken to limit the risk of infection include avoiding close contact with untreated people, limiting exposure to the disease, which is considered to be the most effective prevention. There is no vaccine at the moment, but one is actively being developed. Although prevention is not always possible, where leprosy is endemic, control should always be possible. And finally, patients with long-term therapy no longer present a risk to others who are unaffected.
Public health implications. In 1991, the WHO passed a resolution to eliminate leprosy as a public health problem. It stated that there is about 1 case per 10,000 persons. The widespread use of multi-drug therapy has shown a dramatic decrease in the global disease. The WHO stated that leprosy treatment needs to be integrated into general health services, ensure that financial and human resources are made available for the elimination of leprosy, especially in developing countries, Because the stigma of leprosy is an obstacle to self-reporting and early treatment, the image of the disease must be changed at the global, national, and local levels. And a new environment in which patients will not hesitate to seek diagnosis and treatment must be fostered. The WHO also recommends the following to contain and eliminate leprosy: accessible and uninterrupted multi-drug therapy services for all patients through flexible and patient-friendly drug delivery systems. Sustainability of multi-drug therapy services by integration of leprosy services into general health services and training general health workers to how to treat leprosy effectively. Encouragement of self-reporting and early treatment by promoting community awareness and changing the image of leprosy. Monitoring the performance of multi-drug therapy services, the quality of patient care, and the progress made toward elimination via national disease surveillance systems.
To avoid getting leprosy, take the precautionary measures to stay away from other people's nose and mouth droplets. Be safe and be wary.
That it has rod-shaped single-cell arrangement cells. God damn it, I said
God.
the wrong thing.
Dear
In nutrients which significantly
beep.
the skin and the nerves outside the brain and spinal cord, called the peripheral nerves. It can also strike the eyes and thin tissue lining the inside of the nose. The main symptom of leprosy is disfiguring skin sores, lumps, or bumps that do not go away after several weeks or months. Skin sores appear. Pathology. Leprosy primarily affects the skin and the nerves outside the brain and spinal cord, called the peripheral nerves. It can also strike. Oh no!
Pathology. Leprosy. It can also strike the eyes and the thin tissue lining the inside of the nose.
Okay, keep going.
No, I can't keep going, Mara. Primarily affects the skin and the nerves outside the brain and spinal cord. The peripheral nerves. Can also strike the eyes and the... Leprosy is already high, so there is not necessarily a need for a preventive medicine. Holy fuck.
This is all messed up.
Shit. Responses and treatment. The degree of natural immunity to leprosy is already high, so there is not... No, fuck that. Why did you do that?
It's the same thing.
But I wanted to do it when you get to the bottom. To avoid getting leprosy. Shit.